So my dad fell yesterday. He got messed up. They had to put like a bunch of stitches. Oh. And he broke an orbital bone. He's 80, so it's if you do human behavior in the social environment, this is.
Where did he fall?
He's 80, so he has been doing more falls, and he fell on the front porch. It's brick, and so I think he just. I think he might have just caught like the edge of that brick and it just like ripped open. It was like 6 inches and then it broke the eye bone here. So he's okay, but it's all, I mean, that's rough. If you're, you learn how to walk when you're a 1-year-old and then you lose all your muscles and your movement. And, he's probably lucky. I know it's gruesome and looks horrible, but he survived it. You know what I mean? Like you hit the edge of a step that's like that, like a brick like that, you got head trauma that could be more of a stroke. So I think he was lucky. It took all day. Yeah, it took all day. He had a stroke to his eye 5 or 7 years ago. I didn't even know you could have that. It's called a retinal occlusion. So like the same way we get cholesterol that blocks our heart, you can get cholesterol to block the blood to your eye, and he's blind in that eye. So they have to reassess though, like because I think your skull holds your eye bones up apparently. So if it is broken and it's not healing properly, like they got to do something. I think even the stitches on the forehead require some form of plastic surgery because that could be a mess. So that's kind of been what we've been dealing with. I know that's hbse 2, kind of the tail end of life. And anybody know what the average man lives to be in America by chance? It is in the 70s.
76.
Mm-hmm. I hear it is. COVID dropped it like a year or two. It might have been 78, and I think now they said COVID and fentanyl lowered our average life expectancy. Hi. How are you? Yeah. Anybody know how long the average woman lives in America? What's that? I bet you it's way more than men. Let me do this one. How long do women in U.S. live average? Okay. 81.1. So we were mentioning how long male dropped below 76 now too. So 75.8 for men, 78.4 for women. And they say difference, historically, men have had higher rates of smoking, drinking, and unintentional injuries impacting their longevity. Health risks, men face higher risks of heart disease and certain cancers. Women experience higher rates of certain autoimmune issues and maternal mortality. And then the socioeconomic factors are racial and ethnic disparities play a role, with Black and Hispanic women sometimes facing greater barriers to healthcare access, impacting outcomes. So that one is a big research study we've been doing the past 3 years here at Central State. And if I could find it, I'll show you. We published something on racial equity and behavioral health, and did a couple research projects. So we did both qualitative and quantitative data, and we found there certainly was a disparity. And we gave a couple presentations on it. If you're interested, I will happily send you our research. You just got to email and say you'd like to see it. We did a couple PowerPoints from it, and that is one of the challenging factors. So on the other end, so those of you that came in late, my dad fell hard yesterday. He got them stitches, so he's fixed up. He's okay, however okay can be, but he's 80. So like you take a fall like that, it's not easy. They were hoping to, take it easy, be kind of retired. He's trying to retire at 80. And maybe this is a forced retirement. I don't know. So on the other end of death and dying, birth and dying, is the challenge of getting pregnant. So one, we start out with often challenging, like one thing that a lot of us have noticed, like when you don't want to get pregnant, it's easier. And when you do want to get pregnant, it's harder. A lot of people have that experience. So planning and like how the family takes on a new baby. So as a social worker, a big one, I'm going to try to take notes like I did last class so I can give you guys some notes. Anybody use AI for notes yet? So you can record it to the cloud and you have them do a write-up like that. So we at least have everything written up for you. It's creepy. So as social workers, we assess the expectant parents, and it could be any age range. Maybe I'll even start that. What do you think the oldest person is that that had a baby? What's the oldest mom or dad? 50? I think that's happened. Do you know somebody who had one at 52? Really? Like a relative or a friend? That's impressive. And they had the baby?
Or like grandparents.
So they and everything was
Maybe like 40 something.
Yeah. So the chair of our department had Ari when he was 53 2 years ago. So Dr. Perdomo, because I keep be 18 when I'm 65. So I feel like an old dad too. I think the average age is 20 something. Does that make sense? What do you think the youngest? Anybody have a youngest story they're willing to share? Who's the youngest that had a baby?
When I was in high school, I had a friend who did. She was 15.
You know her now or see her
No,
now?
I don't know her anymore.
Okay.
That was
Yeah.
back then.
Yeah. And that could be hard. Like imagine how hard it is to like keep our shit together in adulthood. And then you got a kid. Yes.
My best friend, she's 23 with an 8-year-old, meaning she had a
Okay.
baby when she was 15.
And so how's she handling? Are you able to share any stories?
Yeah, she good.
Really?
Kids, she's just her daughter mad because it's like a kid raising a kid.
Right.
They care.
Right.
My daughter.
Part of me wonders if that's how I messed up my kids. I'm like an old man raising.
Yeah, and like you're strict, you know how I feel like. She,
Maybe.
So the baby
Yeah.
hung out with us.
Yeah.
The baby was hanging out with us.
So you hear somebody's pregnant. As a social worker, like we are ready to walk into any shit that can happen every day. I don't even know how to break it down. I've had some weird scenarios that have happened on I've been a social worker since 2001. So it's 25 years now. And that's, my specialty is addictions. And so when you assess expectant parents, you're doing the assessment of them like, what are their attachment and commitments? Probably at 15, it's school. In school?
I would say I met her at 16.
Yeah. How was it? Are you able to share, willing to share?
It's easy.
Is it? Okay.
Easy.
Maybe the youth is helpful. Like you can keep up. Like I feel tired. I want to go to bed.
I'm tired, but I know my plan.
Yeah.
So I have a plan. that I'm focused on.
That's awesome. And then, so how old now are they?
My daughter's 4. She was 5. In
Okay. So like kindergarten soon.
For kindergarten next year.
I just got to call my 4-year-old. They said, we might have him repeat preschool next year. And I'm like, hell no, kindergarten is free and preschool costs money. Ain't nobody repeat. I'll go to a different school before he repeats preschool when I pay for it again. Like I'm serious. Like we already have a 3-year-old going in and you got to pay for that. I'm sorry. We don't get paid enough for that. So assessing expectant parents, like for us, they'd be like, they're old. How are they mentally representing the fetal infant, the past history of social and professional support? So I'm going to erase the genogram, but like our family history, how do we see what things we pass through our family genetically, mental health wise, ADHD, bipolar, alcoholism, all the things that come up. Also history of loss, like we had miscarriages. So that's the thing that comes up and why I say when you want to have a baby, it's harder to have a baby, it seems. And when you don't, it's like, oh shit, that's how we got pregnant before the wedding. You know what I mean? Like traditionally we would want to be like, yeah, we got pregnant on our honeymoon. Well, that didn't happen. And then we had miscarriages after that is 1 year old. Anybody know okay, so sense of security, work and parental leave policies. So if you're working, do you know anything about like FMLA or any of those things? So no matter what, you might not get it paid time off, but you are able to leave your work with FMLA for so many numbers of weeks. Like usually, I will go to AI for this one. Anybody know what the FMLA policy is? How long is, I bet it'll be long too, FMLA leave. And they're not supposed to really ask questions. Like it could be any medical. So you can get 12 weeks. Yeah. Unpaid. You know what I mean? So if you had vacation time saved up, like we had a baby last school year and I saved up time to at least do 2 or 3 weeks at home because it's hard when you have a new baby, like doing all that stuff. Like they wake up every 2 hours. You got to feed them. If you're bottle feeding or breastfeeding, you got to deal with the other kids. So it does allow, hold on, a special exemption allows 26 work weeks. That's half the year in a 12-month period for military caregiver leave. Okay. So 12 months. I know most of us already know how to get pregnant. This is interesting though, because there's a lot of details. Some things I never knew myself either. Like we took the Creighton method class, like how to, like when you want to get pregnant, how to time it, how to have a girl. The last one, my wife wanted to have a girl, so she timed it for a girl. I think she's full of shit, but she said we had a girl. We had a girl. So girl sperm swim way slower. So like if you really wanted to, knowing the ovulation cycle first, and then you time it way out in front, is the male sperm just is like freestyle all the way fast to the egg. But if you time it way before ovulation, say like 10 days, the girls are slower and they're going to make it. And then they sit there and then the egg drops. That's her theory, that her friend got a girl, her cousin got a girl and she got a girl. I still think she's full of shit, but apparently there's some research on it. So we have 2 boys and 2 girls. I'm sure you guys know some of the, let's blow this up because it would be bigger that way. Oh, not for me. That's smaller because it's presentation view. So maybe, so knowing women can't get pregnant if they don't have mucus. So it's a weird statement, and that's the main thing we learned in the Creighton method, that like if we actually wanted to get pregnant, the mucus carries the sperm to the egg. So like if you actually want to have a baby, there's got to be mucus. So she would assess that. They also do temperature. Um, say somehow she got the girl's sperm to be sitting there. I still think she's making stuff up, but we had a girl, so I can't prove it. The first, anybody heard of the ectopic pregnancy before? So that means if the egg is fertilized in the fallopian tube and it's supposed to travel out here, it already starts dividing like 2 cells, 4 cells, 16 cells by the 3rd day. If it attaches inside the fallopian tube, you can die. So that's like the biggest example of threats to pregnancy. Normal is the egg falls out on the 4th or 5th day. It attaches to the uterine wall. The woman has more not estrogen, but progesterone. So when you're older, you don't make as much progesterone. So that's why you're more likely to have a miscarriage. And progesterone tells your body not to shed your uterine lining, which is a period. And that was how one of ours would have been lost. So the doctor gave her progesterone pills, and then it tells your body you are pregnant, don't shed the uterine wall. As if it attaches here, and then you have your period, it flows right out. It just leaves. And I don't. At that stage, I would imagine it's like that. You don't know. So that's the first a few weeks. Also, does everybody know how long you're pregnant for? Anybody know the number of weeks? 40? Did you say 40 or 30?
40.
It is 40, which I always thought was weird. Isn't that 10 months?
Yeah, and everybody says 9 months, but
So I had to dig into that one, and apparently they start week 1 is your last period before you ovulate. So you got 2 weeks there, and you actually get pregnant on week 2 or 3. That's why it's 40 weeks. But they follow the whole cycle. I was like, what are they talking about? 40 weeks. You're not pregnant 10 months. You could be. That's dangerous as hell, though, too. So, like, if the baby, and they talk about that later on. So right out of the gate, on 11th or 12th day, I don't know when pregnancy tests work. Is it right away? Because your body knows and it starts giving off the
I think it's 2 weeks.
2 weeks. So, like in our case, we wanted to be pregnant. We had pregnancy tests, and then because we knew she was older, go get the progesterone so you don't shed the uterine lining. So it's only an embryo for the 2 to 7 weeks. And that's what's crazy, though, is you're 90% formed. So like the basic structures are in place, like hands, heart, and it is the critical period. So embryo is most vulnerable to the environment. And that's, do they call it stage 1? What do they call the first term 1? Is it your first term of pregnancy? Term? Trimester. Thank you. So the first trimester is when you're most likely to have a miscarriage. So that's why you usually don't tell anybody until you are 12 weeks. Is it 8 or 12 weeks? Like you don't tell people at risk of if you had a miscarriage, and you got to go tell them it's not. So a lot of people, you'll tell your mom and dad, you'll tell your family, your sisters. So then the fetus is 8 to 40 weeks. And that's when you have like the refinement, the basic structures. The last 2 months, you store a lot of fat. They gain like a pound the last week. I think they gained a pound a week the last 2 or 3 weeks. So anybody know what an average baby would weigh? Does it say in there?
6 kind of.
Yeah, yeah. And then, okay, here it is. So 24 weeks, you have a chance of survival outside the womb. So like if it is early and say there's an emergency, you got to do a C-section. I think this is old research because that was 2018. Now it's like the 21st week, 20th or 21st week. It can live, like they put it under a blue light or something, and like the breathing tubes. the last thing to form is your lungs. So, and then if you have them early, we had most of ours 37 weeks, 38 weeks. They won't do inductions until the 39th week because they want your lungs fully formed. So if you want to be induced because you're in pain, they're like, no, you got to be full term right here. It's 39 to 40 weeks. And that would be late term is 41 weeks. I would hate the person who had 41 weeks of pregnancy. Anybody in here know anyone who had 41 weeks? It probably because the baby weighs like 7, 8, 9, 10 pounds. Like it's gaining a pound a week at that point. That's why they do induce at like 40. Anything anybody else want to share about or stories or?
My daughter came out a week late.
So you were considered 40 weeks or 41?
I was considered 41 weeks. But I was in labor for 3 days at home.
Was she heavy then? Was she like 8 pounds?
Mm-mm.
7?
She's tall. She's tall.
Okay.
Her dad's tall.
Yeah.
So I was already once we dilated when I was 5 months because how tall she was.
So how tall is that? Like 21 inches when they're born? I'm trying to think.
Tall. She was
Yeah.
tall. I can't remember exactly, but she was tall.
Yeah.
She was long.
And there's several ways to do it, like at home or at a hospital, or you can have a doula at a wing of a hospital in case like an emergency happens. So they're starting to have doulas right there. So if an emergency happens and you rush to the hospital, I think people like bathtub or swimming pools, baby pools. Have you ever seen that?
Yeah.
So is that just, I guess, more natural? Because
It helps. Water helps.
okay.
It helps.
And that can be I don't know as much about the doula stuff. I know we thought about it, we never did do it. So okay, when you have the baby, here's the things that keep it alive. And I forget which one. I think the placenta comes out first sometimes, then the baby. Maybe the baby comes out, then the placenta.
Baby come out and
Okay. And some people fry it up with them eggs or like put it in pills, but that's different. Culturally, it's different. Whatever people do with the placenta, it has a ton of iron in it and it's healthy. Culturally, some people bury it in a garden because it gives good plant growth. They let you keep it for stem cells, but I think you have to pay a lot to keep it. And then we always gave ours away, but I found out if the hospital keeps it, to them it's worth $50,000. I had no idea.
You don't get paid for it.
No. No. You can keep it, but if you relinquish it, they take it for.
You can keep it they'll just take it maybe.
Yeah, you could freeze it. You could. It has lots of. Well, I think they show a picture later on. It's not like a live picture. My friend had twins at home, and then they had both the babies and the placenta on Facebook. I'm like, dude, you can't put the picture, but he did. So I guess don't they edit those or what do they take them down sometimes? Like you can't put up a.
Yeah.
But I don't think they took that one down. So
They
You
take
also-
down the wrong stuff every time.
what's that?
They take down the wrong stuff.
Right.
every time.
Yeah, they do. So I also had to cut I didn't have to, but I cut it. I was like a wimp about it because it's like skin. You like cut it with scissors. And then our first one, the amnion bag started leaking. So that's why she came out early. And like, if there is no fluid, that can be dangerous to the baby. So they did like let her go early. But that's what the baby is in, like floating in a bag. And sometimes they have to go in and break it. Your water broke. Like if your water didn't break to tell you to go to the hospital, at the hospital, they break your water for you. So sometimes you run into abortion, the spontaneous or induced ending of pregnancy. 75% of spontaneous abortions occur in the first 12 weeks. Not all vaginal bleeding is a miscarriage. We actually thought one of ours was, but it was the baby detached then reattached. So it freaked us out. Social worker in this case plays a supportive role. So separate, personal from Professional values. I have two things I want to show you guys on this. Women have less regret and emotional problems when the choice is not forced. So, has anybody seen? I'm going to take forever to remember the name. This is Jane. It came out like a few years ago. Or it's like I am Jane Doe. I always search forever on this. I am Jane. I am Jane. That's it. Well, no, they had one that was made more and I thought that it was a big movie when it came out. All right, so on that side, I was going to show that, and it's kind of the history of Jane Doe in 1971. And then there is another one on the other side. I guess I should write these down in my notes. Because these are the things that we see, and maybe the internet is so edited nowadays that it's hard to find some of these. Maybe it's just that's what pops up. But there's two documentaries on either side of it. So there's a woman who worked at Planned Parenthood. Here's the trailer. Okay, I can show you guys. Oops.
Abby Johnson is in the other room.
Here.
Our first order of business is to present Planned Parenthood's Employee of the Year Award. Abby Johnson.
This is Abby. She's our newest volunteer escort. Abby, this is Cheryl D'Alessandro.
I'd be the youngest director in Planned Parenthood history.
You'll actually be in charge of the abortions at your clinic.
I have a chance to make a real difference.
No matter what you do for the rest of your life, you're still gonna be a baby killer.
The only thing that's changed is you, Abby. Can you even hear yourself talk right now about these procedures? These are little babies.
I'm not going to apologize for doing a job that helps women in crisis.
There's still a part of me that isn't sure.
I know. But the one thing that all experts agree on is that at this stage, the fetus can't feel anything.
Sorry to bother you, but they need an extra person in the back room. Are you free?
I saw it. It was like it was twisting and fighting for its life.
We commend the souls of these hundreds of children. And Lord, we pray to end abortion.
I really appreciate what you've done for us. I'll not forget it.
22,000 abortions. How do I even comprehend that?
Rough day at the office?
I say that.
It's your dad and me. You are our baby from the moment of conception.
We are paying you to be a perfect instrument of corporate policy. We are an abortion provider.
I can't be part of this anymore. Everything that they told us is a lie.
Don't underestimate the repercussions of this. You gotta be careful.
Rhonda, please don't do this! Rhonda!
Let me tell you what's gonna happen if you walk through that door.
Congratulations. You've made an enemy of one of the most powerful organizations on the planet.
So that was kind of a real life story that happened, and then movie of This Is Jane. I think it was 2019. I Am Ask for Jane. That's it. Okay, it's
time.
So maybe some of you have already seen this one. I don't know. It did come out in 2019. Okay. I don't think this is the one that I...
We just had a student die from drinking raspberry.
No, we don't know that she was pregnant.
What happened? I saw her go in my drawer and take a razor. My parents are really religious. I can't go home like this.
Hello, Nancy? Do you think we can get together $1,000 for Patty?
Let's see who's awake.
What if we had women call my dorm room? Hello? And we can tell them to ask for Jane. This is Jane.
Jane Doe.
It would be anonymous. 23-year-old?
30-year-old mother of 4, 20-year-old college student.
Thursday.
I just want you to know that I know what you're doing.
Apparently we are the abortion 7.
Wow, right there in the paper.
I want to help them. We're up to 30 women a week now.
If you need volunteers, you can call me.
This is your whole life you're putting at risk.
I feel like it's my responsibility to help.
You lied to me. You're not a doctor?
We're all criminals in this room, and that includes all of you.
Women's bodies are always in men's hands. But this was us doing it for us.
This is Jane.
So there's obviously quite a few of the trailers that have come out in the past few years, and that's one of the things as social workers to be supportive for. If you do make it to labor, you mentioned it was like 3 days, you said?
I had 3 days at home. Yeah. But I didn't know it was labor.
Right.
I didn't know because I didn't have my water didn't break.
Right.
None of that. Nothing.
Right.
And then I would just sleep. And then my last day staying home, I told her I didn't feel her move that whole day. And then the whole time she was fine.
Okay.
And then they broke my water at the hospital after the second day.
Okay.
So they said basically if I didn't push out by that night, I would have to have a C-section.
That's so we had over 24 hours. So they mentioned it could, the first stages like 12 to 14 hours. They won't let you in the hospital unless if your cervix at like 5. I don't even know how to visualize. I feel like 5 is like that. And I'm not, 10 could be like that because the head does smash when it goes through and then it rounds back out again. So usually the baby turns around, I think flips upside down, dilation, then you've got 10 minutes to 3 hours, baby is delivered. Well, I think we had 24 hours on ours the way you described because, and you're already tired. So then they want you to like push like you're a marathon runner. And it is hard. And then, what's that?
I slept the whole time.
Did you?
I slept, I woke up and her head was out.
Because your body naturally contracts, right? Yeah. And then they would have us, they had me like hold the leg and then they would time it. They'd like watch the contractions and they'd be like, all right, hold the legs and then help. Last part is, okay, 5 to 30 minutes after the placenta is then delivered. So there's a picture of a placenta. And that has all the nutrients, the minerals, all of the important stuff. They even recommend not cutting the cord like the way the hospitals do. They cut it right away. They say to keep it attached for like an hour or 2 or 3 as all that stuff's going through to the baby. So everybody does it differently, but that's one thing you could do. And then the even more important is recovery. They call family time. So the golden hour, you do skin to skin, so both the mom and the dad hold the baby, and that's super important because they might be covered in like the mucus, and they also don't wash that off because that has the I want to say probiotics or like good bacteria on that mucus is important for the baby's development. I think at least the hospitals don't wash the baby for the first 24 hours. But I've seen some articles say do it for like 2 or 3 days even because it's just important bacteria. I don't know how to describe it, but that's the golden hour, skin to skin. They take like stamps of the baby's feet. So sometimes you're holding them, they got a stamp on you, which is hilarious. And then, yeah, somebody mentioned the weight. So 5.5 to 9.5 pounds is average. I think our first one was 6.5, our second was 7.5, our third was 8.5, and then 8. So they get bigger and heavier than if you have a few because maybe your body's able to handle it better. And then the doctors will do the APGAR score, adaptation to life outside the womb. And that's usually the first 5 minutes after birth. Heart rate, breathing, reflex, muscle, tone, and color. They give you a 0, 1, or 2. Like one of ours had such bad mucus and like they were drawing it out. I'm like, dude, is he even breathing? They're like, oh, they're fine. But I swear it was like, it seemed like 60 seconds the kid's not breathing. But they got all the mucus out. They were fine. Lungs are last thing to develop. So 7 to 10 is considered good on that one. And then score of 0 to 4 is likely associated with neurological defects. So knowing that as a social worker, even when we do our assessments, we ask about how birth went. Was it premature? Did they have any birth defects? So some complications of pregnancy, you've got frequent vomiting, hypermenesis gravidium, I can't say it right, vaginal bleeding that can lead to spontaneous abortion in early pregnancy. Vaginal bleeding in later pregnancy is called placenta previa. That's what we had experienced, is when the placenta separates from the wall of the uterus, but then it reattaches. Toxemia could be if due to protein in the urine. Eclampsia or gestational diabetes, they make you drink this nasty orange drink that my wife described. It's like, it looks like a McDonald's orange drink, but it has so much sugar in it. And you have to digest all the sugar before you leave. And if you fail the first one, you got to do it again. And the older you get, the more likely you fail it. So she always would fail I think the final time somebody gave her the exact diet to do the day of, like no bread, no carbs, just straight up eggs, and then do the test. And I think she did pass it. And you could also have intrauterine growth retardation. There's a lot of things that come up at birth. So maternal age, 18 to 35 is ideal. We were after 35 for all of our babies. So we were called geriatric pregnancy, old people. And it turned out okay, but they're always worried. Nutritionally, you only eat a few hundred extra calories. So I always thought you could eat like a whole box of donuts or a whole large pizza, but I guess it's 300 calories extra. And you will gain 25 to 30 pounds the last 3 months, high in protein. Maternal stress and illness could come up. Multiple gestations are riskier than having younger gestational ages. And then sexually transmitted diseases can be transferred. This is one I do make mention because that is when they will do a, what do they call it? You just said it, cesarean section. C-section. If there's an outbreak of essentially it's cold sores, so herpes simplex 1, and this is something as a college person I didn't know either. Cold sores can be transferred all 4 ways, and this is important to know because if somebody got a cold sore, be cautious. 80% of us have a cold sore. It can be transferred down there, and if you got an outbreak while having the baby, it can be transferred to the baby. So as a precaution, they do a C-section so it doesn't have to pass through the vaginal area that could have herpes simplex 1 or 2. But I didn't know cold sore on the mouth, and then it can be passed to genitalia, all of the above. So being cautious, and then extra cautious if there is that occurs, to have a C-section to make sure the baby doesn't get it. I didn't know that till I was in college. I wish they had done better sex ed for us when I was growing up. Drug use. So they can test your first 5 months of drug and alcohol from the baby's poop. So the first poop that comes out, that's the first time I guess the baby ever really poops. So it has everything from the last 5 months. And when I worked at Claremont Recovery Center, a lot of times, because that was back when weed was not legal, you would have kids incarcerated at the JDC and the baby at least temporarily placed because there is just THC. So any agent, teratogen, that could cause a birth defect. Alcohol is probably number one. So they say fetal alcohol syndrome. And if you think about it, we could handle 2, 3, 4 drinks, but the baby's like that big. So you get them 2, 3, 4 drinks. They share the blood with you. So it can really do some damage. And that's why even in Kentucky, they had a huge, when I went to grad school in Kentucky, billboards everywhere about like even just one drink. Up until the 70s or 80s, they thought you could have one drink. And they're the research is showing not even one drink when pregnant. It increases the chance of miscarriage, low birth weight, cognitive abilities, etc. Drug use can cause addicted infants. I don't know if you guys have ever seen like a baby detoxing off of fentanyl. Yeah.
So if something like this were to happen and the baby does come like addicted to something the mom may have been taking while she was pregnant, how would that like show in the baby? Like what would be the symptoms that present in the baby?
Physically, so they can test it in the poop first off. So their first poop has the last 5 months of your usage. I think, if I'm quoting that correctly, I can back that up with some research. I'd have to look it up, but
like, does the baby have a higher chance of like growing up and still being addicted to the certain drug?
They can take them off of it. So the NICU often deals with it. So I think some examples are like, I don't even know how to spell it if I did the proper spelling, but like they're just very shaky. Here's, oops.
She is in severe withdrawal. This is the group of babies that was all born to moms that are opiate users. They can be very, very irritable. They have these very high-pitched cries. They can be very shaky and tremory. And in the most extreme form, they can have actual seizures from the withdrawal. Right now, she is having some tremors. The fentanyl crisis has been very real. I mean, opiate use in general. Since the time I started practicing in pediatrics and neonatology, there's been an increase in over 300% of patients. I know. What we found is that there's so many of these moms that are using that we're not comfortable with sharing that information.
If a pregnant woman comes in and she holds this information back, how does that impact the care?
If they wouldn't have shared it with their provider, they wouldn't know that it's actually more dangerous to stop using if you're already pregnant. So they would try to get themselves off of it and sometimes cold turkey stop using.
People are going to hear that. What?
The baby can die inside. So the baby will then also go through withdrawal, much like the mom will if she stops using, and it can cause the baby to actually die in utero.
Why do they not want to share it?
No, because of the judgment that goes along with it. The more that we judge these mothers, it will continue to get worse because they won't come for help. In the early 2000s, every mom that had any type of history of drug use, including marijuana, they had oftentimes automatic CPS calls.
That's changed in a great way.
They know that we're not here to take their kids. We're trying to keep them together as best we can.
So I don't know if that answers the question. Is that?
I bet that's a really crazy moral dilemma for the workers.
For sure. Have any of you ever seen 30 Days of Heroin in Cincinnati? I show it a lot in my classes, so I don't want to bore you showing it again. Maybe next week. There it is. I think it's called something else, but I always. Here's a quick trailer of what the if it still works. Oh, it's on Facebook though. That's weird.
Babies will be born to heroin-addicted mothers. Courts will take children from addicted parents. Taxpayers will spend heavily to lock up drug users. People will overdose in gas stations and parks and school parking lots.
I can show it next week. I intended to do a self-care one too, but
It's the first day of another week of the heroin epidemic. Over the next 7 days in greater Cincinnati, at least 180 people will overdose. 18 will die.
so that
This is normal now.
this is only about
This
6
is a
years
typical
old.
week.
It's a well done documentary about Cincy and just everything that goes on there. So that's what they said was right. It was way more judgmental before. Like when I first started in 2001, now they, overall they want to reunite the family. This is so you make sure you get your alls. If you have a student loan, sign every one of those the first 2 weeks. They freak out about it. They will snatch back student loans if you don't sign that sheet. And I remember them doing it to us. So important to have prenatal testing. Okay, drug use can cause addicted infants have difficulty actively engaging. Alcohol is the biggest preventable cause of developmental disabilities. It's important to have prenatal testing, like drug testing, ultrasounds, and then may require ethical decisions whether to terminate the pregnancy. So sometimes you find out about trisomy 21. Anybody heard of trisomy 21 before? It's Down syndrome. So like if you've seen someone with Downs, I think it's the 21st genetic. I can't explain. I'm not a doctor. Well, I have a doctorate, but I'm not a doctor. It's one of your genes is missing and it causes Downs. And these, all of us have probably seen somebody with Downs. Autism is probably the most frequent nowadays. If you've seen the increase in autism in the past 20 years is just astronomical. So that's one other thing. There are so many theories right now. Have you guys heard any of them?
I didn't know there was I didn't know about the increase in neurodivergence.
Like it was 1 in 10,000 in 1989. 1 in 10,000 babies, and now it's 1 in 53 boys.
Oh wow.
Yeah.
That's insane.
So something's causing it. I remember in Cincinnati, they're like, it's because they grew up near the landfill, Rumpke Dump. And there's all kinds of assertions, food or environment or vaccines or something. So some people spread out the vaccines now because you could have the choice to get 4 in one day on your baby. And you can say, no, I only want to do 1 at a time and I'll come back. Because when you get them, your body reacts and heats up a lot and could cook your brain if you have 4 vaccines in you. So your body reacts. So there might be something to the vaccines. Anybody know about autism? Vaccines? Diet?
With the vaccines, our vaccines, when you get injected with basically a dead version of that bacteria, and it
it's supposed to
your
be.
body to fight it off for the whole day.
It is supposed to be, yes. That would be a traditional vaccine. I know now they're doing mRNA vaccines, so apparently those are quite different. See, that's where I don't know how to explain it. We all had to get it to teach here back in 2021. Do you guys still have to get, say, the flu shot or the COVID shot?
We had to get some shots. I forget what the shots were, but we had to upload medical records before we could come. You remember? Yeah.
I know some students said they were able to take a religious exemption or conscientious exemption if you wanted to, but that's all I've heard. So if you didn't want to. Some people like natural immunity. So, yeah. But these are some of the prenatal testing. The autism won't be caught till 1.5 or 2 years. So that again tells me maybe it is something in the environment causing it, not genetically. So genetically, you see like ultrasound or sonogram, you do alpha fetoprotein blood screening, amniocentesis, chronic villus sample. I'm not a medical doctor, so I don't know all these. Timing and safety of administration of these different types of tests, and then non-invasive tests are important on cell-free DNA. They used to go inside the bubble the baby's in and test that, but they found that to be severely dangerous to the baby, so they don't do that as much. Then the ethical dilemma that could come up: terminate the pregnancy if fetus has a major birth defect. We could stop there. Any questions? Anybody ready for snow?
Some stuff just be unnecessary. Like, you know, we don't want it to snow.
Will they even close Monday if it's a lot?
How much is it
supposed to be?
10 inches. At least where I am, a half an hour south. I don't know if it's a band or if it's the whole area is getting dropped on. So I don't know.
They want that money.
I know. I know they do. And they want us to pay their water bill, so.
Hey, okay.
All the teachers are paying the water bill. Yeah.
Why?
Yeah, no, the students aren't. They're incorporating Xenia is engulfing us. And we are now part of Xenia, so we pay a 2.5% tax. The rest of our lives we teach you. Yeah, oh yeah. You start as assistant professor at $50,000. They're going to take $1,000 of it for the water bill, for the fire, police, and water.
That is.
Yes, thank you.
Any other questions? Oh yeah, well, I guess we'll do self-care and gosh, what else did I say? Would you want to watch that 28-minute documentary on heroin in Cincinnati?
Yes.
It's strong. It's shocking. I know a lot of stuff. I should give you guys a trigger warning, so I apologize if the stuff is triggering.
I think that is the trigger.
Okay, that's your trigger warning. As long as they won't shut me down on the YouTube channels, they say that's copyrighted. That's the